Thank you, everybody, for joining us. Please, my name is Tony Ross. I'm the Director of Communications at Provalis Research. Our host today is Lucy Mackintosh. She is going to be doing. Please mute yourselves and close your cameras. We're going to be taking questions at the end of the presentation, and please use the chat feature on the right-hand side of your screen to ask your questions. Our presentation today is by Lucy Mackintosh. It's titled "No Comment Left Behind: The Use of Computer-Assisted Coding in Large Datasets." Lucy's going to be showing us an example using QDA Minor of a large questionnaire. I won't give you a long explanation because I'm sure she's going to do that when she starts off. But it's a questionnaire by the UK Kidney Association and Kidney Care UK. Lucy's a senior research assistant at the University of Hertfordshire. Lucy has a background in psychology, studying both her undergraduate and master's at Hertz University. Predominantly, Lucy's research focuses on patient experience of kidney care and analyzing the patient-free text comments in response to kidney patient reported experience measure. Currently, Lucy is working on a multi-phase study looking at the center characteristics, practice patterns, and patient experience of kidney care during COVID-19. Just before we start, at the end, we also have our next Lunch and Learn will be taking place on April the 18th, and I'll give you a brief description of it at the end of this session. So now I'll turn the presentation over to Lucy.
Thank you, Tony. Thank you for that introduction, and thank you to everyone joining today. I am based in the UK, so apologies now if I talk a bit fast or with my accent, because I know I am a very fast talker. So as Tony said, I am a senior research assistant from the University of Hertfordshire. And the focus of this webinar today is to really discuss how I used QDA Minor for the first time back in 2020 to analyse over 7,000 comments, which were retrieved from kidney patients in the UK. And really to kind of focus on how in an analysis like that, comments don't get missed, because with patients, they had their say, and we wanted to make sure that no comment was left behind. So apologies, this is going to start off in a lot of detail about QDA Minor. So if you've used QDA Minor or are familiar with it, this might be a bit repetitive, but hopefully you can still take away some of the hints and tips. So a little bit of background. So as Tony said, I work in collaboration with UK Kidney Association and Kidney Care UK. So each year they send out a validated questionnaire to measure patient experience of kidney care. So the whole of the UK will receive this, all the kidney centres. There are 39 questions based over 13 themes of kidney care, such as accessing the renal team, how the renal team treats them, transport, environment. And these are on a Likert scale. But for those who complete the PREM, so the patient reported experience measure online, they have access to the free text question, which is if there is any other aspect of your care that you have that has not already been covered during COVID or another time. Obviously COVID is now a bit more redundant, but back in when I first used QDA Minor it wasn't. Please tell us below. And additionally, there was 3 free text questions purely on COVID, asking what was good, bad, or what could be made better about their experience during this time. So to kind of see what I did with QDA Minor and to see the outputs and the reporting of this, here is a link to the Patient Reported Experience Measure website. So you can see kind of yourself how we went from receiving the comments to what we reported. So the first thing to do was creating a project in QDA Minor. So our measure is on Qualtrics, which is an online survey maker platform. So from there, we could export all the data to Excel, and then from Excel, we can upload to QDA Minor directly. So it's quite easy to create a project that way. So the first tip is about saving. Now, I know that sounds really silly, but we're quite used to now having stuff connected to our OneDrive or our iCloud, and so things save automatically. QDA Miner doesn't. So I always made sure I had a working file, and now I periodically saved and dated previous versions. It also helps that if you code something in one way, or you accidentally delete something, you can have your versions back and revert back to older versions. So this is what QDA Miner looks like. So for those who haven't yet used QDA Miner, this is what you will see. So you have your comments here. So the documents are your different questions. So for us, we had our general question and then the 3 good, bad, and better questions related to COVID. You've got your cases, which are each individual comment. So for us, there are patient comments, the variables below. So we ask demographic questions from our patients, such as what treatment they're receiving, their age, gender, ethnicity, and that is supported there. Also, their responses to the scale of questions before, based on the 13 themes of kidney care, they're also reported. So later on, I'll talk about reporting by variables, but it's always handy to have them there. And then on the bottom left, you have the code book. And on the right, you can see the codes relating to that comment. And so as you code, you can select certain parts of the comment to code specifically, or you can code the whole thing, and you can drag and drop from the code book, or you can select and double click. So in terms of functionality, quite easy to get around, and everything you need is in that one space, in that one view. So creating the codes, again, apologies for those who use QDA Miner. This is obviously very basic. So codes, add, and then you can name your code and you can select categories. So QDA Miner has this really easy function for creating categories which your codes can sit under, and then you can also create categories underneath categories. So you can have your comprehensive coding structure set up from the beginning, or you can just add codes and then add categories afterwards. You can create shortcuts. So if there's codes you know that are going to be repetitive, so if you're doing deductive coding, you can create shortcuts and and copy and paste and make shortcuts for codes to make it easier that way. You can also color coordinate. So someone like me, old school, used to highlight and write codes and do it by hand. I find it really easy to color coordinate my categories so that from a quick glance through the comments, I can see what theme they belong to. So for me, 7,000 comments, it was difficult to imagine where to start with coding. Normally a qualitative data set has around 10 transcripts, or you're looking around 50 comments. So 7,000 was a huge number. And so QDA Miner has the functionality to retrieve text. So here you can see, you go analyze text retrieval, you can select the question in which you want to retrieve, whether it's coded, and then you simply just type in the word you want to retrieve. And so for us, it's an experience measure. So we know that some patients will say nothing to add, or nothing, or no comment, and derivatives of the same sentiment. So here we collected none. We got 362 hits. So that meant within our 7,000 plus data set of patient comments, 362 responded none. A quick scroll through, we can see that some patients put more than none. So what this patient highlighted in green put none, very happy. Now, based on why we were coding, that didn't really fit. That person had left a comment. They said they were very happy with their care. And so you can, using the bin function, you can remove that from that hit. So you can remove that one comment from the hit. So it doesn't delete the comment from the data set, but it does delete it from the hits. And then you can select the code, or you can add using the blue tick a new code. We did nothing to add as our code for all the derivatives of that, as there was nothing further the patient wanted to add. And then using the double button here, the green and orange pen icon, you can code all hits. So as you can see there, we selected our code, and then you can code all hits. And then in one click of a button, 362 comments are coded. So the first hint is that for us, we had 3 different questions. Now, not all patients commented or left a remark in all 3. Now, for QDA minor, it has to have a response in the box to read it. And so we had to put not answered in the blanks to ensure that the patient data across all 3 was uploaded. Otherwise, if we left it blank, QDA minor wouldn't be able to read that comment, and therefore that case would be excluded, excluding the data for the other questions that were answered. So if you do have a data set and you want to, I don't know, compare variable information such as gender to those who left a comment and who didn't for your entire data set, I would input that as not answered. You can then text retrieval, not answered, get every single blank response that you've had to input and code it all in one hit as not answered. So very quickly, you've coded for the blank responses, and then they're included in your data set moving forward. So coding cluster extraction. So this is another thing that QDA minor allowed, which meant that coding was really quick and straightforward. So using cluster extraction and selecting just the uncoded comments, QDA minor groups words and phrases from the comments together based on having a similar semantics. So here you can see that they group them in 3 stages, either tight, medium, or loose. So we started off with tight, so 120 items in 29 clusters. This accounted for 6% of all comments. So from this, we can see here are the comments that are grouped together. In bold is what they've been grouped on. So here it's to do with water. A quick scan, as there's only 4 in this cluster, you can see no water, water, no water dispenser, no water dispenser. And so we can see here that this is all to do with what's available in the unit, whether or not kidney patients are offered a drink or a drink of water specifically during their treatment. As you can see, there are slight differences with, no being added or more specifics being added. So depending on what level of coding you wanted to do, whether you wanted to be specific or whether you could group them, depends on whether you cluster the coding together. So any codes you put under cluster codes groups all the comments contained in that, whereas the right-hand side only codes based on that individual comment. And then we also have the coding using grid layout. So you can set your QDA minor. So as you can see, this is a slightly different interface to what I showed you first of all. This is in grid view. And so because I'm selected on a specific comment, I've had to blur out the variables to keep patient anonymity. But here in grid view, you can view very quickly each comment, the case number, when selected, the variables, and also the codes. And then in the box below, you have the comment, and you can edit on that comment box more easily. So here you can put it, it should be on this one. So here you can see you've got remove coding, comment on your coding. So obviously when doing qualitative analysis, you're encouraged to leave memos, add hyperlinks, resize your coding. So whether you want the whole comment to contain that coding or whether you want it to be based on a smaller part of the comment, you can recode, save the quote. So saving quotes, I'll come back to quotes later, but that's really handy if you are going through your comments and you see something that you think would be really great to report, you can save that there. And you can also change the color of your coding. So this is a really good interface, I find, that once you've fully coded, to go back and when you're doing your quality checking. So if you're mistakenly coded something while doing cluster extraction, you can go back and easily recode or change the coding there. Go through checking whether you're renaming codes. It's easier to see in this grid layout. So top tip two is filtering. So when in the grid layout, you can also add filters to reduce the amount of comments to match your focus. For instance, in kidney research, there are 5 different types of treatment a patient can select to help with their kidney disease. And so here we can filter by treatment and only have a specific treatment type come up. But you can also filter and sort. So when coding, you can sort your codes to alphabetically, text length, the number of codes it contains. So if you want to check all of your nothing to add codes, you can sort by code size and text length, and then you can have them grouped together or alphabetically, and then you can filter down. So this is just a way of, if you have a large data set, you can kind of control and focus on specific elements of your comments. So hint 2 is quality checking. As a part of qualitative research, obviously you will know that you have to quality check and make sure that there's a team that are agreed on the suitability of codes, naming of codes, the themes and retheming. And this I find was best done in the grid method, as you can easily change codes and edit based on agreement. And also other people can use QDA Miner. So there's a way to input, and people can share data sets through QDA Miner. And so other people can also leave comments and memos and comment on each other's based on their opinions of the coding. So it's a really handy tool for quality checking the research. So another thing I did, based on it being an experience measure, is using attitudes. So as well as coding based on the thematic of the comment, I also coded based on its sentiment. So based on experience, someone can have a positive experience, a negative experience, or a neutral experience. So each comment was also given one of these codes, and it was underneath its own category of sentiment. And this meant that later on, when we were doing the analysis, we could see whether patients commented on one aspect and whether that aspect was considered positive or negative overall, and see the differences there. We can also see the differences in this meaning of the comments based on different variables as well by adding that. So if you are doing a kind of experience or a satisfaction or a perception measure, adding sentiment is really handy because it just adds another level to your analysis. Okay, so back to looking at the attitudes, sorry. So as you can see here, we've got attitudes and each of the different sentiments. And then here you can see that this is a positive comment about staff. And so it's been assigned both positive and staff as its codes. So also codes for all comments. So there is a way that you can right-hand click on each of your categories, retrieve segments, add an all comments with the category name, and code all hits. And this just means that you can retrieve at once each of your different categories and see. There is another way that you can just, when selecting your codes for analysis, selecting the themes, but I found it a really good way of being able to analyze each of the themes at a theme level and not just code level. So yeah, retrieving the segments and coding in this way. So as you can see, communication was selected, retrieval segments, a new code name was defined, and then all hits under communication were coded, communication all comments. So now on to the fun part, and the bit that makes it really interesting, because a lot of people do wonder how 7,000 comments can be reported concisely enough to be able to be analysed and interpreted, but also in a way that, you know, no comment was left behind. So coding frequencies. So presenting the findings, coding frequencies. So here you can retrieve and actually retrieve coding frequencies, and you can select. So here I've selected at theme level. So I've created all my additional codes with each theme and all of its comments. And here you can see that environment was the theme most commented on in 2020 by patients, followed by how they were treated by the renal team. Privacy and dignity, sharing decisions, fluid and diet were the themes that were least commented on. So here are the 13 themes of the kidney PREM, and that's how we reported it. So we were able to see very quickly where the issues lied. You can also present these in charts. So just using the same coding frequencies, there is a chart icon, and you can create bar charts. Also for quality checking, I recalled all codes and based on their frequency, because at the bottom there was quite a lot of comments that, or sorry, there was quite a lot of codes that only had one comment assigned to them, and so it was easier when quality checking to see whether or not those codes could be merged with other codes, and therefore when using the grid method you can recode to match the code you feel it best suited. You can also pick up in the frequencies any repetitive codes, so codes that have similar names. QDA minor will let you know, or in fact won't let you create codes of the same name. However, if you change them slightly or do a variation, then that's fine. So coding co-occurrence. So this is where our look at sentiment came in. So again, I've done it by theme level. So based back on what we saw that environment followed by how the renal team treated kidney patients were the top or most common themes to emerge from the data. So then using the coding co-occurrence, we can also see negative, neutral, and positive by each of the themes. And so here we can see how the renal team treated you had 86 positive comments and 122 negative. So not only can we see that this was the second most common theme, we can see that it actually was predominantly negative. And here is the table. So unfortunately, QD minor only presents it to you in this style, but you can easily save it to Excel. You can then take out the repetitive rows. So you can make sure that you select the negative, neutral, positive and present it in this way. And then therefore you can see very, very quickly each of your themes by sentiment. And you can pull out by scanning how positive or negative they are. So access to the renal team was hugely negative with 163 comments versus the 18 positive comments. Privacy and dignity was solely negative. So here we can not just tell centres what aspects of care they need to focus on improving, such as environment, we can also tell them why it needs improving in terms of whether it was negative or positive. So you're able to congratulate based on what's been positive and also look at what needs improving with the negative. So then presenting the finding, coding by variables. So coding by variables, we coded for the report based on treatment, age and ethnicity. So we saw not only overall for the whole data set, but based down on treatment modality, age and ethnicity, what patients were saying and what they thought. So to do this, you do coding by variable, you select what codes or at theme level, and then you select the variable you want to code by. So here you can see we're taking dietary advice, fluid intake and weight gain, and we're doing that by treatment. This is also a bigger presentation. So this is each of the themes that emerged, and this is based by treatment type. So as you can see, home hemodialysis, just for reference, is the smallest population of kidney disease patients. So you can see there's quite a few gaps and the numbers are very low. Centre HD is the biggest population of kidney patients in the UK, and so their numbers are naturally high. But within each of the treatment types, you can see what is emerging. So here, environment received the most comments by far for Centre HD, whereas for CKD, so they're the patients not yet receiving any treatment, so they only attend for monitoring. Their biggest comments were on aspects of care such as how they were treated and accessing the renal team. So there's some observations you can make that make sense. For example, those who attend at a hospital probably more likely to comment on aspects of care related to the hospital, whereas those who have home therapies might comment more on accessing the renal team, because if they're not going to hospital, how are they getting the contact? You can also present this. So this is the exact same data, but it's presented in a bubble chart. So here, so as you can see, it's the same thing, but it's a much clearer picture. So rather than having to scan numbers, you can see quite quickly. So the bigger the bubble, the more focused that comment is on. One of my little hints is to do it by percentage. So obviously, as I said, home hemodialysis is a much smaller cohort than centre HD. So I've done this in respect, so it's column percentage. So here I can see that support other was the most common code for home hemodialysis within that cohort. Otherwise, you would have really, really small bubbles for home hemo compared to centre HD. So this is based within the treatment. But again, visually a really useful tool for being able to see within the theme of support what areas affected what treatment modality most. So displaying the bubble charts by column percentage. So this is on the right. This hasn't got any column percentage on it. So as you can see, it's really difficult to kind of define what the differences are between the treatment groups, because that's based on the size of the treatment group. Whereas on the left, using column percentage, that shows you within the treatment group. A little side notes on bubble charts. Some of the things I write this report commercially. So some of the feedback we had from our funders was that you had to have one variable by at least 2 codes. So you can't compare like a variable on a variable. So you can't see whether there's like a gender split within treatments or ethnicity split in treatments. You also can't see like for less than a code, so you can't see a code across each treatment. It has to be at least 2. You can't see the attitudes either, so the bubble charts show all of the comments. So one of the comments would be really great if we could have seen whether each of the themes by treatment, but also a breakdown of positive and negative. What you could do is you could do 2 bubble charts side by side, one filtered just to positive comments, one filtered just to negative, and do the same thing. So treatment by all of the main themes, and then see the differences there. But you can't do it in one graph. So you can't see whether one treatment was more negative about a certain theme than other treatments. And also missing data. So if you are doing a comparison between the two, if a treatment or a certain theme isn't mentioned at all, that won't show, it just will exclude it. So let's say environment was solely negative by every treatment type, then there will be no positive to compare it to. It doesn't just leave it blank, it removes it altogether. And you can't edit a bubble chart. So whatever it produces is what you have. So you can only edit based on what codes or variable you use. And then quote matrix. So I said earlier, we could save codes along the way to report. They can easily export. So again, quotes are exported to Excel, and then you can just copy and paste them into your report. We used coding by variable to make sure that we could get the data out. So here you can see we started off coding by variable. We selected just staff as a code, and we selected tabulate with treatment. So then it comes up with the treatments and the staff codes. And then if you click this blue icon here, it brings up the quote matrix. We can then select other variables to add. So we added gender, ethnicity, and age. And then we run that quote matrix to receive this. So this is just for those receiving hemodialysis in centre. And as you can see, you have the quote then displayed with the age and the ethnicity. And then we can export that out into our report, like shown here, with a really smooth each of the quotes and then what type of patient commented on that. And so for patients looking through, they can see how they've been represented, or people who kind of match their identity. What have they said, and is it similar? Just to point out as well that the quotes were agreed. So when reporting, we do ask in the measure whether patients are happy for their comments to be shared both with the centre and reported on. With QD minor, we can then filter out who said yes and who said no when doing the reporting, so that their quotes are used in the analysis in terms of numbers, but when reporting based on the actual comment, they're excluded. So that's just another top tip, to add the variables to the quote, because again, it just makes it more meaningful. The other thing is, again, with filtering. So I mentioned about filtering in grid method, but you can actually filter all cases too. So here we can select the variable, so we've done it by treatment, to equal a certain treatment type. So for us, we had over 7,000 comments. We wanted to look at it by treatment, by age, by gender, by ethnicity, to really kind of get to grips with what patients were saying, why they might be saying it, and to come up with some conclusions. So as Tony mentioned at the beginning, I'm looking at centre characteristics, practice patterns, and patient experience during COVID. So here I could filter based on different treatments and then looking at what they said and how that might matter for the centres and different regions of the UK. And so you can filter down your entire data set based on the variables you want to focus on. And you can also do this with codes. So you can filter down to just a specific code, and then you can look. So for instance, I said about positive and negative when doing a bubble chart, and then you can run the whole analysis again. So just a summary, because I have kind of spoken and rushed through a few things. So before questions, so we've looked at the idea of saving projects after each coding session and having a working data file, so that any changes can be reverted and so that you can keep up to date. Filling in blank comments with not answered, because obviously, like I said, QJ Minor cannot see a blank comment. So having that put in so you can import all your different documents. If you only have the one question and you don't want to include those with who haven't responded at all, then obviously you don't need to worry about that. Coding by text retrieval, cluster extraction, and using the grid layout. So text retrieval and cluster extraction means that you can code very quickly for your large data set. And the grid layout was really useful for quality checking of your codes. Coding by attitude to give a deeper insight into your analysis, to see whether if it's an experience measure of satisfaction or perception, whether the comments are positive, negative, or neutral. Creating an all comments code so that you can have a theme level as well as code level. So this helps when you're reporting and analysing, so you can break down between theme and codes to have an overall look before you get the deeper insight. Presenting the data by using frequencies, co-occurrence, variables, and the quotes. So those different functionalities of QJ Minor. And then filtering by variable to reduce to a focused group. Just quickly, some of the acknowledgements. So obviously I didn't work alone on this project, so just a thanks to those. Christina Silva is the one from Qualitative Data Analysis Service who introduced me to QJ Minor and kind of helped with that. And then my email address, if you do have any further questions, please do not hesitate to get in touch. Or if there's anything further that I've mentioned or commented on that you would like to know more about, please do feel free to email me. Thank you.
Thank you very much. That was very informative. Sorry if you hear barking in the background. This was my dog, and I can't shut him up. It's probably the mailman's coming by. He doesn't like the mailman. If you have any questions, can you please use the chat feature on the right-hand side of the screen to ask your questions. We are recording this, so you'll be able to take a look at the Lucy's contact information on that slide. You'll be able to look at it on the video. If for some reason you don't have it, or for you all have my email. So if for some reason you need to get in contact with Lucy and you don't have her contact information, or you didn't note it down, just send me an email and I can forward that to you. We have a couple of questions here to start with. Did you deal with misspellings?
Yes.
And how did you deal with misspellings?
Okay, so so when you actually import for the first time to QDA Minor, it does come up with some of the issues and it can correct it. So it kind of comes up with a book of everything that it might be misspelled or abbreviations, and then you can edit for all. So for us, we have a lot of abbreviations in kidney care. So we use CKD for chronic kidney disease, we use HD for hemodialysis. And so we kind of came up and we put that in just to help with the analysis. obviously there's a lot of typos, so QD minor also doesn't like the use of punctuation. So if you use anthesam, it comes up with the symbol and then anth. If you use an exclamation mark, it comes up. If you use, or if patients commented and they used a like don't, it will come up with different symbols between the N and the T there. So we don't change a lot, so it doesn't really matter. So in 2020, we obviously added in all these different codes, and QD minor does remember that. So remember the abbreviations, but in terms of misspellings, we just kind of left it because we really wanted to share what the patient said verbatim. So when we report it, we might take out when there's been like a symbol inputted, we might just edit that. But in terms of coding, it didn't really affect. If some people misspell things quite big that you don't understand the whole comment, we've put it down as miscellaneous because obviously we can't interpret that. But within the comments, some misspellings, you can just jump over them. For example, people who spell does with DOSE rather than DOES, obviously you can understand within the context of the comment. And so we can just interpret that ourselves. So because we get so many comments, no, we don't sit through and worry so much about misspellings. QD minor will pull some of them up, but otherwise you just kind of carry on, interpret what you can, and then just code miscellaneous if you can't interpret it at all. So for instance, sorry, if you're doing an interview and you have a transcript, obviously parts of the transcript might be inaudible. You could just code that as miscellaneous or inaudible because you couldn't pick it up when writing the transcript. And so obviously you can't code for that. And then when you're presenting your findings, you can add that in. So you can get a percentage based on how much of the transcript was inaudible and how that might affect your data. Or you can just leave it out. And just when you're putting up your frequencies or your co-occurrences, you just don't include that as a code.
Okay. Thank you very much. How are you coding multiple attitudes within one comment?
So as I said, with the grid method, you can select certain parts of the comment. So I always hate it because I start off doing it. So I code the whole comment. So for ease and efficiency, I will just obviously in a cluster just code, yep, that's positive and that's negative. And then later on, when I'm quality checking and I'm going through all of the comments, I will then like remove codes or I'll resize them to fit certain stuff. If you've got a smaller data set, you can probably take the time and just highlight. So you literally will highlight what you want. So if someone says the TV doesn't work, that's negative. So you can highlight that TV negative, staff are great, highlight that, positive staff. And then you've got your different things and it only codes what is highlighted. So that's how you can do different sentiment. A lot of people say to me, someone comments a positive aspect and a negative aspect, overall isn't that neutral? No, because when we look at it and we look at it at code level, we want to get the accuracy on that. So whatever you highlight in code will only code what is highlighted. So you can do your sentiment differently that way.
Okay. Do you have any experience with WordStat, Lucy?
No, I don't.
Okay.
Unfortunately.
It's just because there was a question about would you use WordStat if you had even more, but so if you don't have any experience, you can't answer that. So that's fine.
No.
But then the subsequent part of the question is, in QDA minor, what do you find are some of the more effective techniques to speed up coding? I noticed you mentioned clustering, or can you be more elaborate on that? Or are there any other specifics of things that you use to speed up your coding?
Yeah, so my first port of call is the text retrieval. So with any qualitative analysis, skimming through your data to get familiarity is something I always suggest. Obviously, with 7,000 comments, it's really difficult, but you get to see the derivatives of what people are saying. So a lot of people just put great or good. And so having done this for 3 years, my first thing is text retrieval. So I'll type in specific words that I know have come up before, just singular words, retrieve that and code. And then when the text box comes up, it's really quickly as you scroll through to see any derivatives of that. So if someone says great and something else, you can take that out and then you can code all. So I find text retrieval is quicker than cluster extraction, because cluster extraction, when you have the bigger phrases, there's a lot more differences. You have differences by sentiment, differences by what it means. So for example, QDA minor might code based on someone saying no, but there's a lot of ways that someone might just say no, or they might say no, there's not this, or no, I don't like, and then it can make it harder to code. So I would say text retrieval first, then cluster extraction. And when you get to cluster extraction and you've got to loose, and you find that things really don't sit well together, or you're having to code individually, stop with cluster extraction, because it's just more time consuming. And then just filter through, so filter just to uncoded, filter based on text length. So I always leave the longest comments till last. We don't have a limit on how many characters someone can use, so I always code those last because they're the most time consuming.
Okay. Did you use the code similarity search at all?
No, so this is something that I want to do. But when I spoke to Christine Silver, who assisted me, she said that the data had to be set up in a certain way, or that we couldn't do that. But I'm currently looking at coding transcripts, so different to what I've done before. And I really want to look at the code similarity to see, we've got different patient groups we're interviewing, so I want to see the similarity between them based on what they've said. So no, I haven't used that yet.
Okay. Can you upload a theme list, or did you have to enter it individually? The themes.
Yeah, no, you can. Sorry, so I'm a bit confused by the question whether or not they meant like importing the code book, or whether they mean by theme, whether you can look
I
at that
I think
individually.
it's creating the theme list. Can you upload a theme list, or do you need to
Yeah,
enter
yeah.
the themes individually? I think that's
No, so
specifically the question.
in code you can import a code book. You can import themes, so you can import stuff you've already done, so you don't have to start from scratch. So yeah, hopefully that's answered that.
I think so. Um, well, thank you very much. Thank you very much. And there's whole lot here of very positive comments. So by the way, in terms of sentiment, all of the comments are positive.
Thank you.
So we can't compare them with any negative comments, because they're all positive. Thank you very much. Very much appreciated. As I said to everybody, this is being recorded, so you can go back and look it over. Also, Lucy has put her. If you look in the chat feature, Lucy has put her contact information in the chat feature. If you do want a copy of her slides, please email her directly, because she's not going to be downloading these questions and looking for them. So if you want something, contact her directly. And as I said before, if for some reason you misplace it or lose it, then contact me. Our next Lunch and Learn is going to be on April the 18th at the same time, which is 12 noon Eastern in Eastern North America. It's called The Quest for Validity. It's also merging deductive and inductive research tools to create more valid research findings. Dr. Abby Jones is going to be giving this presentation in this session. She will demonstrate how to merge Provalis deductive and inductive research tools to learn to reach your validity goals. Specifically, you will learn more about how to use WordStat content analysis to create a dictionary and then transform it into a much more accurate code book and for findings in QDA minor. Thank you very much, Lucy, again. Very much appreciate it. Good luck with the rest of your work with QDA minor and exploring it. We'll also be sending you a license for WordStat, so that if you want to explore WordStat, you'll be able to do that as well.
Thank you very much.
Thank you very much. And one more sort of pledge, or not pledge, but request to everybody out there: if you've got a project that you've done, doesn't necessarily have to be done with our software, something on qualitative or content analysis, we'd be very happy to hear from you, and can present to this Lunch and Learn. And sometime in the future, just contact me, and we'll explore it and take it from there. So finally, have a great rest of your day wherever you are. Have a Have a nice supper, Lucy, and
Thank you.
we'll be talking to you soon. So thank you very much, everyone. Bye-bye.
Brilliant. Thank you everyone for attending.
Bye-bye.